Hello, let's talk about the another station from the pathology for MRCS Part B, and that is tuberculosis. So the tuberculosis, and the scenario for this is a young Indian lady came back from a foreign travel with cervical lymphadenopathy, interior triangle mass, loss of weight and night sweating. Okay, so the first question is, what will be the differential diagnosis? So the first differential is Hodgkin lymphoma, because it is more in this age group and involves cervical lymph nodes more commonly. Then the second is TB, tuberculosis, because the young lady with a travel history and loss of weight and night sweating, so it can also raise suspicion for TB. And then the third one is infectious mononucleosis. Okay, so which labs you will send her sputum to? So we will send her sputum for microbiology and cytology labs. The other question, what are the tests to be done for TB? So first is sputum examination for culture and the Ziehl-Neelsen staining. Okay, then the Montauk's test, and the third one is PCR. Okay, polymerase chain reaction to differentiate Mycobacterium tuberculosis from other species. So what are the other species of the Mycobacterium tuberculosis or Mycobacterium? It can be Microbacterium avium, Microbacterium sacrophalacium, okay, and Mycobacterium marinum. Okay, so these are the other three species of the Mycobacterium. So in order to differentiate those species from the Mycobacterium tuberculosis, we have to send the PCR. Okay, then the quantiferon interferon gamma assay. Okay, interferon gamma assay, which is also called interferon gamma release assay, IGRA. Okay, but this test has the false positive result for the BCG vaccination. Okay, so if someone has BCG vaccination in the past, so this test can be give a false positive result for tuberculosis. Okay, then the fine needle aspiration cytology of lymph nodes, because there is lymphadenopathy. Okay, then how to label the sputum specimen. So sputum specimen can be labeled as category B UN 3373. Okay, and where to put those specimen in a biohazard bag which is red in color. Then the organism for TB tuberculosis is the most common is Mycobacterium tuberculosis. Okay, then the Microbacterium avium and intracellularly, this is the another species which lead to disseminated infection in immunocompromised patients. Then the Mycobacterium bovis. What are the culture media for Mycobacterium? So it can be solid media or liquid media. The solid media can be Lowenstein-Jensen media and Middlebrook media, and the liquid media is Bactec MGIT. MGIT means Mycobacterium growth indicator tube. How long to culture? Okay, so for 6 to 12 weeks, this is the duration to culture. What type of protein deposition occur? Amyloid AA. Okay, now Here in this question, given the fine needle aspiration cytology result, necrotic tissues, histiocytes, and giant cells. So interpret these results. So this is granuloma, which is most likely due to tuberculosis. Okay, so this is the interpretation of this result is granuloma. So the other question is, what are the surgical what are the what are the surgically relevant examples of granuloma? So the examples of granuloma are fungal infections, okay, fungal infection, Crohn's disease, foreign body, aspergillosis, sarcoidosis, tuberculosis, leprosy, rheumatoid arthritis. It can be also the other causes, like other fungal infection can also, the parasitic infection can also lead to granuloma, like schistosomiasis. Okay, then the question is, what are giant cells? So giant cells, they are multinucleated cells formed by fusion of monocytes or macrophages, often forming granuloma. For example, Langerhans giant cells, okay, and Reed-Steinberg cells. Okay, if the lady is diagnosed with TB, what is the next step? So our next step is to first is to notify the consultant, okay, notify the consultant in communicable diseases control, and notify health protection agency and give anti-tubercular medications. Okay, then avoid working in the food factory. Okay, and the third one is contact tracing, the identification and diagnosis of persons who may have come into contact with an infected person for last 21 days. Okay, so these will be the next steps. Okay, first we will notify the consultant in communicable disease control and notify health protection agency and give anti-tubercular medication. Then avoid working in the food factory, and the third one is contact tracing. We will have to identify and diagnosis a person who may have come into contact with an infected person for the last 21 days. Now what will be your advice to contacts? So we will have to consult the contacts and screen them and give treatment to the other family members if they are infected. Okay, then what is granuloma? Okay, so the granuloma is organized collection of modified macrophages. Okay, so basically these are the come from the activated macrophages, which resembles epithelial cells and surrounded by the rim of lymphocyte with multinucleated giant cells. So in the later video I will show the granuloma, structure of granuloma. Okay, so granuloma is basically the organized collection of the modified macrophages which resembles the epithelial cells and surrounded by a rim of lymphocytes with multinucleated giant cells. So other causes of granuloma we have already looked at this question. So it can be leprosy, schistosomiasis, sarcoidosis, Crohn's disease, rheumatoid arthritis, the fungal infection. Okay, now we will discuss about the immune response to the mycobacterium infection. Okay, so this includes two steps or two processes. First, infection before activation of cell mediated immunity, and then the second process is initiation and consequences of cell mediated immunity. So before activation of cell mediated immunity, this is mycobacterium. Okay, mycobacterium, it it is inhaled and entered into respiratory tract. Okay, then the macrophage, alveolar macrophage comes, and it bind with the mycobacterium through receptors which are mannose receptors, CR3, and some other receptors. So by binding to the receptors, the mycobacterium enters into the alveolar macrophages, and then it causes the phagosomal manipulation by the three processes. Maturation arrest, it arrests the maturation of the phagosomes. Then it prevent the acidification of the phagosome, and it causes the ineffective phagolysosome formation. So by doing so, it survive in the activated macrophages, and this result in the bacteremia with seeding of multiple sites. Okay, so unchecked dysentery proliferation. So as the uh, mycobacterium causes the maturation arrest, prevent the acidification of the phagosome, so it proliferate inside the activated macrophages and survive there for the long time. Then it causes the bacteremia with seeding of multiple sites. Okay, so this is the first step. Then the second will be the consequences of the cell mediated immunity. So this is the alveolar macrophage. Okay, it is basically the antigen presenting cell. Okay, antigen presenting cell, APC. It present the mycobacterium antigen to the T lymphocytes. Okay, T cells. It present the microbacterium antigen on the class 2 MHC protein to the T cell receptors, and the alveolar macrophages secrete the interleukin 12, which causes the activation of the T helper 1 cells. Okay, T helper 1 cell. Then the T helper 1 cells secrete the interferon gamma, which causes the activation of the macrophages, and by activation of macrophage, it causes the phagolysosome maturation. Okay, and activation. It also helps in the production of nitric oxide and production of reactive oxygen species, and it causes the autophagy of the bacteria, so causing the mycobacterial killing. Okay, so the activated macrophage causes the phagolysosome maturation and activation, production of nitric oxide, production of reactive oxygen species, and autophagy, causing the mycobacterial killing. It also secretes the tumor necrosis factor and chemokines, which recruit the more monocytes and causing the granuloma formation. So this is that granuloma. Okay, so in the center, granuloma has caseous necrosis, and surrounding it there are modified macrophages. So these are the macrophages, specialized or modified macrophages. Okay, macrophages, and surrounding the macrophages there will be sensitized T cells. Okay, so that's the granuloma formation, and it is the consequences of cell mediated immunity against the mycobacterium tuberculosis. Then you can see this is tuberculin test. Okay, tuberculin positive test, and it is due to T helper 1 response. Okay, T helper 1 response, which is activated through IL-12. Okay, IL-12 causes the activation of T cells into T helper 1 cells. Okay, so these are the events occurring during the immune response of to the mycobacterium infection. Okay, so this is all about the tuberculosis station.